Welcome to the PTCB Prep Guide. You are about to master the top 200 drugs, and we are doing it with a strategy that actually sticks. We have stripped away the fluff and broken this massive list into 7 high-intensity batches. Here is the flow. We will narrate 30 drugs at a time, covering the brand, the generic, the class, and the clinical need-to-knows. Immediately after each set, we are hitting a 10-question practice quiz to lock that knowledge into your long-term memory. Once you crush the quiz, we move straight into the next batch of 30. We aren't just memorizing names, we are building your clinical intuition. By the end of this episode, you will have covered the entire top 200 and tested yourself on 70 exam-style scenarios. No distractions, no shortcuts, just pure pharmaceutical mastery. Let's dive into batch 1. First up is metformin, which many people know by the brand name glucophage. It's a biguanide used as a first-line treatment for type 2 diabetes. While it's very effective, it can cause some GI upset, and in very rare cases, lactic acidosis. A key tip for patients is to take it with meals to help with that stomach upset. Next, we have atorvastatin, or Lipitor. This is an HMG-CoA reductase inhibitor, or a statin, used to treat hyperlipidemia. Patients should be told to avoid grapefruit juice while taking this, and to report any unusual muscle pain, as myalgia or the more serious rhabdomyolysis are potential side effects. Moving on to antibiotics, amoxicillin, branded as Amoxil, is a penicillin antibiotic used for various bacterial infections. It's pretty common to see a rash or some GI upset with this one, but the most important thing is always to double-check if the patient has a penicillin allergy before dispensing. Then there's levothyroxine, also known as Synthroid. This is a thyroid hormone for treating hypothyroidism. Because consistency is everything with thyroid levels, patients need to take this on an empty stomach every single day. Side effects to watch for include palpitations and insomnia. For those with asthma or COPD, albuterol is a staple, often seen as ProAir or Ventolin. It's a short-acting beta agonist used as a rescue inhaler. Since it's a stimulant, it can cause tremors or a fast heart rate, so it's good to warn patients about that jittery feeling. Lisinopril, or prinavolin-zestril, is an ACE inhibitor used for high blood pressure. A very common side effect is a persistent dry cough, and it can also cause high potassium levels, so patients should stay away from potassium supplements. If you're dealing with GERD or acid reflux, you've likely heard of omeprazole or Prilosec. This is a proton pump inhibitor that works best when taken before meals. Just keep in mind that long-term use has been linked to bone loss. Warfarin, known as Coumadin, is a powerful anticoagulant used to prevent blood clots. The biggest risk here is bleeding, and it's famous for having many interactions with other drugs and foods, especially those high in vitamin K. For depression and anxiety, sertraline or Zoloft is a very common SSRI. It can cause some nausea or sexual dysfunction, and it's important to remind patients that it usually takes several weeks to feel the full effect. Hydrochlorothiazide or Microzide is a thiazide diuretic used for hypertension. It helps the body get rid of excess fluid, but it can also lower potassium levels, so electrolyte monitoring is usually necessary. Now let's look at insulin glargine, branded as Lantus. This is a long-acting insulin for diabetes. The main thing to watch for is hypoglycemia, and a critical dispensing note is that this specific insulin should never be mixed in the same syringe with other insulins. For pain and inflammation, ibuprofen is everywhere, as Advil or Motrin. As an NSAID, it can cause GI bleeding if used too much, so always advise taking it with food. Amlodipine, or Norvasc, is a calcium channel blocker for high blood pressure. A common side effect is swelling in the ankles or feet, known as peripheral edema, which usually depends on how high the dose is. Prednisone, or Deltasone, is a corticosteroid used for inflammation and autoimmune issues. It can cause weight gain and suppress the immune system. The most important rule here is to never stop taking it abruptly. The dose must be tapered down slowly. Gabapentin, also known as Neurontin, is an anticonvulsant often used for neuropathic nerve pain. It can make patients feel quite drowsy or dizzy, and like many nerve meds, it shouldn't be stopped suddenly. Acetaminophen, or Tylenol, is a go-to for pain and fever. While it's generally safe, it carries a risk of liver toxicity if the total daily dose is too high, so patients need to be careful with how much they take. Clopidogrel, or Plavix, is an antiplatelet medication used to prevent strokes and heart attacks, especially after someone gets a stent. Like other blood thinners, the main side effect to watch for is bleeding. Losartan, branded as Cozar, is an ARB used for hypertension. It's a great alternative for people who can't handle the dry cough caused by ACE inhibitors, though it still carries a risk of high potassium. Furosemide, or Lasix, is a loop diuretic used for edema and heart failure. A good way to remember its main side effect is the phrase, loops lose potassium, so monitoring those levels is key. Fluoxetine, famously known as Prozac, is another SSRI for depression. It can sometimes cause insomnia or anxiety, and it stays in the system for a long time due to its long half-life. Azithromycin, or Zithromax, is a macrolide antibiotic often given as a Z-Pack. It's used for respiratory infections, but it does carry a rare risk of QT prolongation, which affects heart rhythm. Metoprolol, seen as low pressure or Toprol XL, is a beta blocker for hypertension and chest pain. It can slow the heart rate and cause fatigue, and patients should be warned not to stop taking it suddenly. Nitroglycerin, or Nitrostat, is a nitrate used for immediate relief of chest pain. It often causes a headache or a drop in blood pressure. A vital storage tip is to always keep the tablets in their original amber glass container to keep them from breaking down. Cephalexin, or Keflex, is a cephalosporin antibiotic used for skin and urinary tract infections. It can cause some GI upset, and there's a small chance that someone allergic to penicillin might also be allergic to this. Digoxin, also known as Lanoxin, is a cardiac glycoside used for heart failure and AFib. It has a very narrow therapeutic index, meaning the dose has to be perfect to avoid toxicity. It's standard practice to check the pulse before taking a dose. Simvastatin, or Zocor, is another statin for high cholesterol. Just like atorvastatin, it can cause muscle issues, and patients should avoid grapefruit juice. Insulin Lispro, or Humalog, is a rapid-acting insulin. Because it works so fast, it needs to be administered right before a meal to prevent blood sugar from dropping too low. Naproxen, commonly known as Aleve, is an NSAID for pain. It's similar to ibuprofen, but lasts longer in the body. Like other NSAIDs, it can be tough on the stomach, so taking it with food is a good idea. Apixaban, or Eliquis, is a newer type of anticoagulant called a DOAC. It's used to prevent strokes in patients with AFib. Unlike warfarin, it doesn't require constant blood monitoring for INR levels. Finally, we have ciprofloxacin, or Cipro. This is a fluoroquinolone antibiotic used for UTIs. It has some unique side effects to watch for, like photosensitivity and a risk of tendon rupture. Patients should also avoid taking it with antacids or dairy products, as those can stop the drug from being absorbed properly. Now we are done with the 30 drugs set. Let's check ourselves how much we can retain. We will continue with a short quiz session based on the 30 drugs we just learned. This is a great way to see what stuck and what might need a quick review before we move on. After this short quiz round, we will continue with the next 30 drugs, and just like this, we'll have another short quiz session for those as well. Let's jump in. Question number 1. A patient is picking up a prescription for Norvasc. During the intake process, they mentioned they've noticed some swelling in their ankles lately. Which generic medication is likely causing this peripheral edema? Is it A. Lisinopril, B. Amlodipine, C. Losartan, D. Metoprolol? The answer is amlodipine. This is a calcium channel blocker, and it's actually quite well known for causing that dose-related swelling in the hands and feet. Question number 2. Next up, we are looking at a common stomach medication. You are processing a refill for a patient taking Prelosec. To ensure the medication works as effectively as possible, what is the best advice regarding when they should take their dose? A. Immediately after a large meal. B. Right before going to bed. C. On an empty stomach before a meal. D. Only when they feel heartburn symptoms. The correct choice is C. On an empty stomach before a meal. Since omeprazole is a proton pump inhibitor, it needs to be in the system before the meal to effectively shut down acid production. Question number 3. Let's see this brand generic question for a very common maintenance drug. A prescription for glucophage is being filled for a new patient. What is the most common primary indication for this medication that you would expect to see on their profile? A. Hypertension. B. Hyperlipidemia. C. Type 2 diabetes. D. Bacterial infection. The answer is C. Type 2 diabetes. Metformin is almost always the first-line medication used to manage blood sugar levels for these patients. Question number 4. I remember this drug because of a specific rhyme we use in the pharmacy. A patient calls worried because they were prescribed Lasix and heard it can wash out important minerals. Which electrolyte are we most concerned about them losing? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. The answer is C. Potassium. Lasix is a loop diuretic, and we always say loops lose potassium, which can lead to a condition called hypokalemia. Question number 5. Moving right along to a switch in therapy. A patient has been taking lisinopril for a month but tells the pharmacist they can't stand the constant dry cough it causes. The doctor switches them to Cozar. What is the generic name of this new medication? A. Losartan. B. Valsartan. C. Enalapril. D. Atenolol. The answer is A. Losartan. Losartan is an ARB, which treats high blood pressure just like an ACE inhibitor, but without that annoying dry cough side effect. Question number 6. While preparing a Z-Pak for a patient with a respiratory infection, you notice a warning about QT prolongation on their profile. Which generic drug are you currently dispensing? A. Amoxicillin. B. Cephalexin. C. Azithromycin. D. Ciprofloxacin. That would be C. Azithromycin. It's a macrolide antibiotic, and we have to be careful because it carries a specific safety warning regarding heart rhythm. This next one is a classic safety question. A patient is prescribed Coumadin to prevent blood clots. They ask if they can start taking a high-dose vitamin K supplement they saw online. Why is this a major concern? A. Vitamin K increases the risk of liver toxicity. B. Vitamin K makes the medication work too well, causing bleeding. C. Vitamin K helps blood clot, which directly opposes the medication's effect. D. Vitamin K prevents the drug from being absorbed in the stomach. The answer is C. Vitamin K is actually the antidote to warfarin, so if they take too much, it can stop the drug from thinning the blood effectively. Question number 8. When a patient is picking up a prescription for Amoxil, what is the most critical question the pharmacy technician should ask before completing the sale? A. Are you taking this with food? B. Do you have an allergy to penicillin? C. Are you experiencing any drowsiness? D. Did you remember to store this in the fridge? The answer is definitely B. Amoxicillin is in the penicillin class, so verifying an allergy is always the top safety priority at the counter. Question number 9. Let's look at a common over-the-counter concern. A patient is looking for a pain reliever and asks for Advil. You notice they have a history of GI bleeds in their record. Why is ibuprofen a concern for them? A. It causes extreme drowsiness. B. It can lead to severe muscle pain. C. It is an NSAID that can increase the risk of stomach bleeding. D. It only works for fevers, not for pain. The correct answer is C. Ibuprofen can irritate the stomach lining, which is a big red flag for someone with a history of GI bleeds. Question number 10. Finally, let's look at an emergency situation. A patient is rushed into the pharmacy asking for their rescue inhaler because they are having trouble breathing. Which medication are they most likely looking for? A. Advair. B. Albuterol. C. Spiriva. D. Flovent. The answer is B. Albuterol. It's a short-acting beta agonist used for immediate relief during asthma or COPD flare-ups. 30 drugs down, 170 to go. We're moving straight into the next 30 medications and 10 practice quizzes. If you're finding this helpful, please subscribe to the PTCB Prep Guide. Your support is essential to keeping this channel running. No wasting time, let's jump in. Here goes the next 30. Ready? This batch covers a wide variety of drug classes, from statins to antibiotics, so let's dive right in. First on our list is rosuvastatin, which you likely know by its brand name, Crestor. This is a statin used for hyperlipidemia. While it can cause muscle pain or liver enzyme elevation, a great dispensing note to remember is that it typically has fewer drug interactions compared to other statins. Next up is montelukast, or Singulair. It's a leukotriene receptor antagonist used for asthma and allergic rhinitis. You need to be aware of the potential for neuropsychiatric effects, and always remind patients that this is a maintenance drug, not for acute asthma attacks. Moving on to pain management, we have tramadol, brand name Ultram. This is an opioid analgesic indicated for moderate pain. It carries a risk of drowsiness and seizures. Importantly, remember that it is a CIV-controlled substance. Then we have fluticasone, commonly known as Flonase. This is a nasal corticosteroid used for allergic rhinitis. It can cause some nasal irritation. If a patient is using an inhaled version, a key safety tip is to tell them to rinse their mouth after use. Next is pioglitazone, or Actos. This thiazolidinedione is used for type 2 diabetes. It can cause weight gain and edema, so a vital dispensing note is to avoid its use in patients with heart failure. You'll often see escitalopram, brand name Lexapro, being dispensed for depression and anxiety. As an SSRI, it can cause nausea and sexual dysfunction. Advise patients that dose changes should be handled gradually. For GERD, we have pantoprazole, or Protonix. It's a proton pump inhibitor that can cause headaches or diarrhea. It's versatile because it can be administered either orally or intravenously. Next is ondansetron, brand name Zofran. This is an antiemetic used for nausea and vomiting, very common in chemotherapy and post-op settings. Watch out for QT prolongation and headaches as potential side effects. For men's health, we have tamsulosin, or Flomax. This alpha-1 blocker treats benign prostatic hyperplasia. It can cause dizziness or orthostatic hypotension, so patients should take it after the same meal every day to keep absorption consistent. Next is the antibiotic doxycycline, known as vibromycin. It's a tetracycline used for acne and various infections. It causes photosensitivity and GI upset, so tell patients to avoid dairy and antacids, as these can interfere with absorption. Then we have meloxicam, or Mobic. This is an NSAID used for arthritis. Like many in its class, the major concern is GI bleeding. It is convenient because it usually only requires once daily dosing. For diabetes, we also have glipizide, brand name Glucotrol. It's a sulfonylurea that works by stimulating insulin release. This can lead to hypoglycemia and weight gain. Patients should take this one before meals. Next is ranitidine, or Zantac. This is an H2 receptor antagonist for GERD. While it can cause headaches, keep in mind that many products containing ranitidine have been discontinued or reformulated recently. For viral infections, we have valacyclovir, or Valtrex. This antiviral is used for herpes infections and can cause headaches or nausea. A key counseling point is to start the medication as early as possible for the best results. Next is bupropion, which you'll see as Wellbutrin. It's an antidepressant, NDRI, also used for smoking cessation. It carries a seizure risk and can cause insomnia, so it must be avoided in patients with known seizure disorders. Then we have metronidazole, or Flagyl. This is an antibiotic and antiprotozoal used for anaerobic infections. It often leaves a metallic taste. The most important dispensing note here, strictly no alcohol during therapy to avoid a severe reaction. Next is sildenafil, brand name Viagra. It's a PDE5 inhibitor used for erectile dysfunction. It can cause hypotension and headaches. Crucially, it is absolutely contraindicated with the use of nitrates. For skin infections, clindamycin or Cleocin is a common choice. This lincosamide antibiotic is notorious for causing C. diff-associated diarrhea. Instruct patients to report any severe diarrhea immediately. Next is spironolactone, or aldactone. This is a potassium-sparing diuretic used for heart failure and even acne. It can cause hyperkalemia and gynecomastia. Patients should be told to avoid potassium supplements. For anxiety, we have buspirone, or Buspar. It's an anxiolytic that can cause dizziness or nausea. It is important to note that this is a maintenance medication, not something to be taken PRN or as needed. Next is another statin, pravastatin, brand name Pravachol. Like Crestor, it's an HMG-CoA reductase inhibitor for hyperlipidemia. It shares the side effects of myalgia and liver concerns, but, like rosuvastatin, has fewer drug interactions than others in its class. Then we have insulin aspart, or Novolog. This is a rapid-acting insulin for diabetes. The primary side effect is hypoglycemia, so it must be administered right along with meals. For allergies, there is loratadine, brand name Claritin. This antihistamine is used for allergic rhinitis. While it's a non-drowsy formulation, some patients may still experience a headache or very mild drowsiness. Next is cyclobenzaprine, or Flexeril. This is a muscle relaxant for spasms. It causes significant drowsiness and dry mouth, and is strictly intended for short-term use only. For BPH or hair loss, we have finasteride, brand name Proscar, or Propecia. It is a 5-alpha reductase inhibitor that can cause sexual dysfunction. A major safety note: women who are pregnant should not even handle crushed or broken tablets. Then we have famotidine, or Pepcid, another H2 receptor antagonist for GERD and ulcers. It's generally preferred over older drugs like cimetidine because it has far fewer drug interactions. Next is clonazepam, brand name Klonopin. This benzodiazepine is used for seizures and anxiety. Because it causes sedation and carries a risk of dependence, it is a CIV-controlled substance. For glaucoma, we have latanoprost, or Zalatan. This is a prostaglandin analog. Interestingly, it can actually change the patient's eye color. It should be applied as 1 drop once, daily at bedtime. Next is vancomycin, or Vancomycin. This glycopeptide antibiotic is for severe gram-positive infections. It carries risks of nephrotoxicity and ototoxicity. Interestingly, the oral form is specifically used to treat C. diff infections. Finally, last in the list, we have zolpidem, brand name Ambien. This is a sedative hypnotic used for insomnia. It can cause complex sleep behaviors like sleepwalking. It should be taken immediately before the patient is ready for bed. All right, 30 questions down. Now for the retention check. Let's jump into the quiz and see how we do. Coming right up, question number 1. This is about brand generic identification. A patient presents a prescription for Crestor. Which of the following is the generic name for this medication? Is it A, atorvastatin, B. Rosuvastatin, C. Pravastatin, or D. Simvastatin? The correct answer is B. Rosuvastatin is the generic name for the brand name Crestor. Question number 2. Moving on to drug safety and warnings. Which medication carries a boxed warning regarding neuropsychiatric effects and is not intended for acute asthma attacks? Your options are A. Fluticasone, B. Montelukast, C. Albuterol, or D. Tamsulosin? The answer is B. Montelukast, also known as Singulair, is a maintenance drug that carries the specific warning for potential neuropsychiatric side effects. Question number 3. Let's look at drug classifications. A technician is filing a prescription for tramadol. Under which DEA schedule is this drug classified? Is it A. Schedule 2, B. Schedule 3, C. Schedule 4, or D. Schedule 5? The correct choice is C. Tramadol is a Schedule 4 controlled substance because of its potential for abuse and dependence. Question number 4. Here is a question regarding contraindications. Which of the following medications should be avoided in patients with a history of heart failure due to the risk of edema? Is it A. Glipizide, B. Pioglitazone, C. Metronidazole, or D. Spironolactone? The answer is B. Pioglitazone, or Actos, can cause fluid retention, which may worsen heart failure. Question number 5. Let's talk about patient counseling. A patient taking metronidazole should be counseled to avoid which of the following substances? A. Dairy products, B. Grapefruit juice, C. Alcohol, or D. Antacids? The answer is C. Alcohol must be strictly avoided with metronidazole to prevent a dangerous disulfiram-like reaction. Question number 6. Regarding drug interactions, which medication is a PDE5 inhibitor and is strictly contraindicated with the use of nitroglycerin? A. Tamsulosin, B. Finasteride, C. Sildenafil, or D. Bupropion? The correct answer is C. Sildenafil, commonly known as Viagra, can cause a life-threatening drop in blood pressure if used alongside nitrates. Question number 7. Let's focus on antibiotics. Which antibiotic is specifically associated with a high risk of causing C. diff infection? Is it A. Doxycycline, B. Vancomycin, C. Metronidazole, or D. Clindamycin? The answer is D. Clindamycin is well known for increasing the risk of Clostridioides difficile-associated diarrhea. Question number 8. Regarding pharmacy safety precautions. When dispensing finasteride, which of the following is most important? A. Take it with a high-fat meal, B. Pregnant women should not handle the tablets, C. Avoid exposure to sunlight, or D. Do not take it with dairy? The correct answer is B. Finasteride can be absorbed through the skin and may cause birth defects in male fetuses. Question number 9. Next, we have a question about administration timing. Which medication should be taken immediately before bedtime due to the risk of sleepwalking and extreme drowsiness? A. Zolpidem, B. Cyclobenzaprine, C. Clonazepam, or D. Buspirone? The answer is Azolpidem, or Ambien, is a fast-acting sedative hypnotic that requires the patient to be ready for sleep immediately after taking it. Question number 10. Finally, let's look at laboratory monitoring. A patient is prescribed spironolactone. Which of the following lab values should be monitored closely? A. Sodium, B. Potassium, C. Glucose, or D. Calcium? The answer is B. As a potassium-sparing diuretic, spironolactone can cause hyperkalemia, which is an unsafe increase in potassium levels. Phew! That's a wrap on batches 1 and 2. We just crushed 60 drugs and 20 practice questions. To keep things easy to digest, we'll cover the remaining batches in the upcoming videos. Specifically, batches 3 and 4 are up next. How did you score? Let me know in the comments. And make sure to subscribe so you don't miss the rest of the top 200 drugs. Thank you for watching. See you in part 2.